Good evening. I would like to call the Kent County Public Schools Board of Education Thursday, July 22nd, 2021, fiscal year 22 reopening plan and ESSER 3 community session to order. The first item on the agenda is to approve the agenda as presented for this meeting this evening. Do we have a motion to approve?
I move that we go ahead and approve the agenda.
We have a motion by Mr. Johnson. Do we have a second?
I'll second that.
We have a second by Ms. McGee. Any further comments, questions? Hearing none, we'll call for the vote. All those in favor?
Aye.
Aye. Hearing no opposition, the agenda is approved as presented. The next item on the agenda is the Pledge of Allegiance. Mr. Buckle, I'll lead to this one here, so give you a break on that one. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. The next portion of the meeting is the reopening plan.
Good evening again. At this time, what I'd like to do is just bring you some information with regard to our reopening plan. I do not have a PowerPoint that I'm posting. This time last year, we had posted our very first reopening plan, which included the preparation for students returning to school remotely, as well as hybrid. And it went into great detail with regard to the health and mental health services and academic services and continuity of learning that we would provide in such a time. In the past month, we've received directives that we are basically to go back, take a look at our reopening plan, revisit it, and make revisions that will reflect where we are currently with our plan. So tonight, what I bring to you is a live, in-process document of our plan. So we have had an initial meeting where we are, as you know, so excited that we will be returning back fully, all students, 100% face-to-face in our schools. We have been very carefully going through each section of our plan, and I can't remember if you have the red line version in front of you. You may have, yes. So you're actually seeing the live changes as we are beginning to make those changes across our plan. I'd like to just point out a few things. One of the first things we wanted to mention is that there are some intensive services that will be provided to our students with regard to social and emotional learning, and that is spelled out in our plan. They include a description of our commitment to various programs, SEL programs, as well as support for staff members as well, because the plan not only reflects what we will be doing for students, but services that are available for staff members as well. As you know, the plan is really a collaboration. And one of the things, and I'm not going in order, I'm just sort of giving you highlights of the plan. One of the things that you'll notice as you go through the recovery plan that is posted, the draft, is that we have expanded our committees, our task force committees, so that we could have more community involvement and voice in the development of our plan. So at this point, we have the good fortune, I think Dr. Keene has nominated, and she's here tonight. Yes, thank you. Please remind me of your name because I just went blank completely. I know, Elizabeth Prophet, and I had Avi. If I said Avi, I'd be fine, but I was like, Mom's name? Okay, so Elizabeth Prophet is here, and she will be joining us on our team, as well as Ana Padilla. Ana Padilla Lopez will be joining us as well. She will also be one of the members of our team. When we met today as an administrative team, we had an all-day A&S meeting. Our principal said, while you're up there tonight, would you mind also saying that if there are others that would like to be part of this process, we welcome them. So you'll see in the draft that's posted, there are task force leaders. If you look at one of the committees and that you take a liking and have an interest and want to be part of that, we love the help. So please, our emails are always end in the kent.k12.md.us, so you can take any of our names, first initial, last name, email us, and we will be happy to have any type of support. And I know the meeting is being live streamed, so there may be parents also that take a look and are interested in helping. This plan will be posted actually after tonight, because tonight will be an opportunity for both the board and anyone in the public, both at home or in the audience tonight, to give us any immediate input or feedback, but it will remain posted. We are asked to send a first draft to the State Department by August 13th. So we're on the fast track with this. We're trying to be sure that we communicate and clearly publicize our commitments in these areas. The plan is also to be understandable and in a uniform format. So we have not changed the formatting of our plan. But our purpose for tonight is really just to open it up and seek public input or comment on the draft of the revised plan. As I pointed out, the main changes seem to just lie within the fact that we're going back face-to-face. So we no longer have to have a procedure with handling student materials, where in the past that was an example of something that we had to be very careful about. They had to, be mindful of putting certain materials in plastic bags and making sure they were safe and, virus-free before no sharing of materials and other examples like that. So some portions of the plan, fortunately, we've been able to modify and remove, and others have moved to what we would call just an appendix at the end. So we're still holding on to our plans for hybrid and the fully remote, just in case. If we have to pivot on a dime, we're ready. We don't have to start over. We still have that information readily available, but we are excited and, as I said, confident at this point about being able to return fully back to the way we typically go to school. So the other piece, if you have not had a chance to see this, and I'm not sure that we made this clear, is that we include a full-fledged communication plan. I think you may recall a few minutes ago, Dr. Sperry talked about one of our commitments this year is to really be giving increased opportunities, not only to share information out, but to get information back to us, that whole two-way communication. So if you haven't had a chance to do that, you may want to click on the communication plan, and that spells out in detail those types of commitments that we will make. One other thing that I just wanted to mention is you may be wondering, so what will happen with Schoology? That's a platform that everyone knows, and we spent a lot of time on there this year. Well, Schoology is not going to go to the wayside. What's going to happen is our teachers will be able to utilize that in various ways in the classroom. For example, if a student is needing some specialized instruction within their classroom in small groups, they may be able to access that through recordings on Schoology while the teacher's teaching the whole group. So that could be one example. We also said what we hope will be a rare case, perhaps someone is quarantined, they would still be able to have access to the teacher and to the lesson by being able to get on Schoology and look at some of that information. So we don't want to lose the momentum and the skills that we've built as teachers to be able to use that. We want to be flexible and continue to maximize the resources that we have. The state has emphasized the importance of using data, and we mentioned earlier in our plan that we have the EFA exam, early fall assessment. So that is also listed, and that will drive some of that diagnostic approach to the new year. It will be the first time in all the years that I've been working where they're doing something which makes so much sense. They're going to start the year by giving the assessment from the previous year. That's a great way to see, have students master that curriculum of the previous grade level, and if not, what do we need to do to be able to move forward to help them close that gap? So we have a clear assessment plan that's spelled out in our document as well. What I'd like to do is just pause at this point, unless I didn't know, Tracy, not to put you on the spot, but did you want to mention anything about attendance? I know that we were returning to our regular attendance plan, and I just didn't know if we wanted to make any comments about the...
Thank you, Gina.
You're welcome.
Yes, we are returning to our attendance policy and procedures, as everyone is across the state. Here's where it gets a little tricky. What most of us are grappling over, what are we going to do? How are we going to handle the situation when, let's say Sam comes to school and for whatever reason, like, you've been exposed. Well, at this point, and let's say you have to, because of whatever reason, you have to quarantine, right? So what do we do with those kids that are potentially out of school for 14 days? I mean, we won't have, we've got to figure out, what is that going to look like? Is that one way in which we're going to use Schoology? And if so, well, what does that look like? And then that also brings, forward another little wrinkle, which is, okay, well, what does that do to our attendance? We've been told that students must be in school, they must be receiving direct instruction to have that present code, right? Whereas before, you could be home, let's say on a situation where you're on quarantine or whatever, and as long as you're participating virtually, you were coded present. We may not have that option. Where that would, again, affect us is one of the things on our state report card is chronic absenteeism. Well, chronic absenteeism is measured in this way. A student is considered chronically absent from school if they miss 18 days or more, and it does not matter whether it's an excused or unexcused absence. So you can see it sounds like attendance on the surface is going to be a really simple thing to figure out, but there are some, unintended consequences of some of these particular scenarios that could come up. And, we've been working over the past couple of weeks as a student services group statewide to just kind of have the conversation. What are you doing? How are you going to handle this? And then also hoping that Maryland Health Department will give us some guidance across the state that we might be able to use, as well as MSDE saying, okay, here might be some loopholes that you could use in terms of your attendance and your coding. So that's kind of a long answer, but yeah.
So I do have a question for you, Ms. Williams. So you mentioned MSDE and kind of waiting for that. It appears as if, as it has in the past, there's been a lot of work done at the local level. There's
Right.
been a fraction done at the state level in
Right.
collaboration, and then it seems that MSDE is crickets. And so it's kind of a statement as well as a question, but there's no. I mean, you can turn on the news and see that there's a little tickling of potential issues across the country where now, LA is full mask 100%, and there's
Right.
things that are kind of getting kind of wonky. And I'm not throwing the fire alarms. I'm just saying that, I guess I'm just curious, do we anticipate greater involvement from MSDE? And I guess I'm just asking everyone, or are we still kind of in a wait and hold, and local systems, you take care of it?
Well,
I know that's, I'm putting you on the spot with that, but, I'm
yeah,
just curious.
and interestingly enough, we do have, when we meet, and we've been meeting, every other week as a group, we've had 4 MSDE people in our calls with us. So they're listening to our concerns. They're also, listening to some of the comments and rationale for why we're saying we're doing what we're doing, and taking that back to, I guess, whoever they answer to, and at least we know that there's a communication chain, because we do have them right at the table.
I'm sorry, Francis, just one more if I can.
Go ahead.
So if by chance, and I'm looking at the 37 or however many pages it is, if we have to pivot, I think Ms. Giacomo said pivot. We've got the model set, the tools
Right.
will be there, that if we have to pivot into a different place, we're good to go.
Right.
Okay.
Right. It's just, these short-term absences based on, COVID-like symptoms or situations. How are we going to handle this? Because one of the first solutions that was thrown up was, okay, well, what about home hospital teaching? Could we do that? Well, here's the tricky piece to that. Unless you have somebody ready to roll, the system has up to 10 days to put a teacher in place to start providing those services. Well, heck, by the time 10 days rolls around, the student's almost back to school.
But do those hospital accommodations, are they counted against the attendance for the year? So
Well,
even
yes,
if it
yes,
takes the 10 days to get to the point where you can be considered a hospital accommodation, are those 10 days still counted against the student for their attendance?
Once the home hospital instruction begins, no.
Ms. Williams,
Who knows?
we know how many of our students 12 and up are vaccinated?
We do not.
There's no way we will know?
Honestly, I'm not sure how to answer that. I mean, I could ask the school nurses, do they, in their database that, which, obviously links to Maryland's Health Department, do we have an idea? But I'm not sure we're privy to those names. I don't
Well,
think.
don't we know about other vaccinations kids have had? Measles?
Yes.
Small, whatever?
Yes, we do.
So why wouldn't this be the same?
I'm not sure, Dr. Costa. I'm not sure about that.
They're not mandatory, so I don't know the
One of the things that we were told at the state level is that the vaccinations are not mandatory. So we can't require that all of our students receive the vaccination. We can encourage them. We can, try to impose the importance of having the vaccination, but to require the vaccination, same with our staff. We're not at a place where we can require our staff to be vaccinated.
Colleges are.
Right.
I
Now-
know, I understand that, but we're a public
Public
Right.
colleges.
Right.
Public colleges.
Now, Wendy, what I will say is, if I go back to the situation and the scenario that we had with our baseball team last spring.
Yeah.
So we had to, individually call all of those parents. And what we did find out, was that any student that had been vaccinated, fully vaccinated, both shots, did not have to quarantine. So we were able to get that information then. I just don't know the legalities, the HIPAA, I just don't know.
I
I'd have to
hope
ask the
the
question.
State Department will come out with some guidance, because I think it really matters. If we have a small number of kids who are vaccinated, we're going to have a lot more trouble.
Thank you.
thank you.
So at this time, we would just like to open it up and give you a chance, to kind of browse through. We will keep it open. We are not required to submit our first draft until August 13th, although we need to have it prepared by August 10th in order for us to get it posted by the 13th.
Right, but I think we can bring it up at our next meeting, the August 9th meeting, in terms of making some further adjustments. I will say that I got off a call today with the state superintendents and also with the Eastern Shore superintendents, and the big question is the question around masking, if it's going to be mandatory or not. At this point in time, MSDE is stating it is optional for masks to be worn in the schools, and that is per the order by Governor Hogan as of July 1st, that masks are not required in schools. However, it is highly recommended that if you're not vaccinated, that you would wear a mask. I know right now in summer school, we did put it out with our summer programs, and we see many of our students. I was in the KEEP program, and there were probably, I would say, about a third of the students were wearing masks.
What
And
about
so
on the bus?
on the bus, it's mandatory to wear the bus. That is a federal mandate, that they
Okay.
have to wear their masks on the bus. But I think that there's a question on whether there's going to be some guidance that's going to change. I know that the CDC has put out a guideline that it's recommended, but it's not mandated. So I think that all of us are kind of waiting to see if there's going to be something that comes out from MDH. And our fear is, after having lived this last year, that right when we get ready to open, and we've already made up our plans, and we said, this is in our plan, we're gonna have it optional, that it's gonna come down, that it's gonna be mandatory. And so I think we're gonna have to be willing and able to pivot and make those changes if in fact that happens. I don't know of any other way to do it. I mean, that's the 24, all 24 of us were on the phone call, and there wasn't a single person that wanted to go out on a limb and say, we're absolutely not going to mandate masks because we really don't know what's going to happen. We understand that there's going to be further guidance coming out in a couple weeks, but we don't know what that's going to be.
Well,
So-
there were some news, articles and other communication out that there are some national agencies that are stating and trying to lean in heavy on
Pediatrics,
CDC
yeah.
to mask all students in the fall, so.
And it's the domino effect, because if that happens at the last minute, that impacts where our students eat lunch, and if, that whole, I mean, there are other things that happen if we make the decision to go back to having to wear masks. So it's just a lot to think about and be ready. That's what we're trying to do. Look at all different scenarios and make sure we think through those pieces ahead of time.
I can see why you want to have some assessments when they go back. It makes sense, but it just seems like all these kids are doing is being assessed all the time. I mean, I'm just shocked at how many tests there are. Do we really need all this? It's constant assessment?
Well, the early fall assessment is a requirement.
Yeah, that makes sense, but
And in addition to that requirement, there's a COMAR where we must assess kindergarten through third grade. It's a dyslexia screener, so we are able to do that through our MAP assessment, so that actually meets that requirement, so we're not giving yet another assessment. But I hear you. It is a concern. We'd like to teach, not just assess, so, yes.
Yeah, Dr. Costa, there's a lot of conversation with MSDE, the state board, as to what that looks like coming out of COVID.
yeah.
Because there's a lot of moving parts to this, as
Well,
Ms. Jackie
clearly, you
Lewis and
have
Ms.
to know where
Williams
people
mentioned.
are when you begin the school year,
Yeah.
after this. It's just that the last hour we've spent, it's a lot of assessment, and, maybe time could be spent better just doing the math
Appreciate
and
any
reading.
feedback on the plan. Please feel free to email Dr. Couch, and we'd love to have your input, so comments, help, whatever you want to do. Any other questions?
Any other questions?
Yeah, I was just, the plan looks good. Will we include regular face-to-face schedules for our students this year? I see a hybrid schedule and a remote schedule, but I don't see any with a typical face-to-face.
That's a good point. I didn't even think about including it, but that's something we could certainly add a sample elementary, middle, high. Is that what you're thinking? Just put it,
Just regular.
yes, sure.
And also, you included previous guidelines for like grading, previous guidelines for attendance, and it said in the home hospital instruction, you said we will revert to the previous guidelines for services there, but there's no previous guidelines.
So we probably need to include a link to that, right? Is that what you're saying?
Yeah, I mean, you listed previous guidelines for
Right.
these other things we did pre-pandemic, but I don't see anything there either.
Correct. So they'd have to go looking for it if they want to find it, right? We want to make it
curious.
easier. Okay. That's a good point.
Any other further questions?
I have a few questions.
Sure.
So all the red is just the stuff that's been revised. Okay. So under the safety and maintaining healthy environments, it says in like the first little paragraph that face covering should be worn indoors by all individuals age 2 and older. And then about half a page down, it says they must. And so I don't know if that means like, are we going to make them optional as in the like should, or like must as in kind of like.
That's a
pushing
great
towards
catch, and it was an oversight, so they should or they must be consistent. I'll find out which one. Thank you, I appreciate that, Sam.
And then my other thing, let me scroll up to it, is under the trauma, social emotional learning, and mental health. At the end of that first paragraph, talking about how KCPS will continue to utilize changing perspectives, second step, positive connections, and the pyramid model. Just a few comments I have on that. I think that a lot to do with mental health, especially in teenagers and stuff, we always lean towards the technology, and I feel like when it comes to mental health specifically and reporting stuff, and even just talking to someone, I feel like our website is just lacking. It's very outdated, in my opinion, and I always go back to Montgomery County because of my connections there with a student member, and just comparing what she has based on what we have. And I don't think it should have anything to do with population. I think that even though we are a smaller school system, our website should still be updated. And I think that also the lack of information for sexual harassment and online forms for that, it took me about a good 5 minutes to find the form for filing something like that, even with the search bar. So I think maybe adding some changes to that. And then I think I had one more comment, if I can find it. Yes, so it was under assessment, curriculum, and scheduling considerations. The second little red paragraph there, which talks about the equity and excellence, a guide to educational equity in King County Public Schools. I was just wondering, I don't know if the members, if there is a member group of that, I was just wondering members of that and if we even have that, and I was just, some considerations I had for those members with curriculum.
Yes, are you asking who's on the
Yes.
curriculum team? So on the, let me get the page number. It actually has a list of the committee chairs for that particular team.
Oh, perfect.
Page 5, I think.
Page 5.
Oh, perfect.
I didn't mean to interrupt you. I just
No,
wanted
no,
to
no,
let
you're
you know that we
fine.
did have the names in there. Go ahead.
Okay,
Also,
perfect.
Sam, actually, Mr. Poor and I got started today on making some updates to the website, but
Awesome.
I'd love to connect with you on that also.
Yeah. Going back to that curriculum piece, I think that I have some things written down from just talking with students about changes in curriculum. I meant to bring this up earlier, but I didn't. Just with stuff with our health classes, we don't really go into a great score or a depth in LGBTQ plus representation. We also don't talk about mobility aids, chronic illnesses, invisible disabilities. We have no way of accountability systems for health teachers who may make comments during class. They're damaging to students' well-being. And we have not created and maintained LGBTQ plus inclusive health classes. And then furthermore, with career pathways, increasing opportunities for middle schoolers to explore these future careers, and then providing access to mentors and other local professors, as we talked earlier, with volunteers. And then a big thing for me, which kind of just is in a sense upsetting to me, is just the lack of just touch with the rest of the school with ESOL students. And I think that just expanding on the number that are hired and diversifying the methods of communication with those students, because the isolation of ESOL students in the student body is just, to me, sad. So I definitely think those are some considerations to look into. And then as we talked earlier, I really think it's a good idea to activity monitor students, especially on well-being, mental health, all that. So yeah.
That was awesome. Thank you very much. And just, I want to make sure I didn't miss anything, but the big categories started off with the masks. You talked about the social emotional learning under assessment and curriculum. The question about assessment and curriculum, because we went off talking about the website, was there anything in particular you wanted added to that portion of the recovery plan, or was that more just about improving the district website?
You're talking about for the social emotional mental health part?
The resources.
Resources.
You were saying under assessment curriculum, and you talked
Oh.
about the health classes and adding the different pieces, but I was just wondering, is there anything in our recovery plan that I should think about? Because again, we're just trying to make sure we don't miss anything in that piece as well.
I think that part of recovering from COVID is also looking back at the past. So if adding better curriculum to the recovery plan, if that's what makes us move forward in a way that is modern, I think yes.
Okay, all right,
And-
thank you.
And to add on to what Sam's saying, I thought I read something recently or last year about how Maryland was expanding the need for LGBTQ curriculum, and that they were going to ask schools to start incorporating more into their curriculum. So I'll try to find that article and send
Perfect.
it around to the board.
How many students at the high school don't speak English?
That's a great question. I don't know that number off the top of my head, but I do have the information. I know that we have 72 students receiving ESOL services in the county, and it's about half and half. Half are, actually, no, it's not. Most of them are at the elementary level. We do have a little bit more middle and high, not quite as many as we have at the elementary level. And in the elementary schools, primarily Galena Elementary School and Garnett Elementary School are the two that have more students than any other school. Sam referenced the support, I think, at the high school level, and one of the things that we have added to our ESSER 3, and Dr. Couch, I'm sure she'll mention this when they share that, is actually additional support for the purpose that you mentioned. So I appreciate you saying that. We were on the same page, saying that we've noted that there's a lot more support needed in that area. Thank you.
Can I just couple of things more as we think about recovery? Just are we planning? Is it the system's priority to offer? I know we say it, but just want to put it on the record. Professional development to. I hate Schoology is a great platform to an extent, a good resource to use, but I don't want it to sit stagnant and not be used, and then pay all this money and nothing get done with it. And because some teachers might revert back to the way they did stuff. So how we can professional development to bring it together, and because I'll never forget when I first started teaching, nobody taught me how to use Google Classroom or taught me how to use our Canvas system. I had to teach myself, and then therefore taught other teachers. So I just think that additional, and as we think about reopening, and as a more I stress this a lot, but I think it's really important as we think about social emotional health and this new way we're looking at education, a way to as we reopen, some type of celebration to really ignite us for the school year, to really make us excited about the avenue we're going into. And I know that's something you can't put in here, but something we should really consider thinking about. I know certain school systems around the state, they do various different things. One being, going to the local stadium and doing a celebration there. I think that would be critical, and I think that would be great to do. Maybe it's riding a bus in a neighborhood and things of that nature. So that's one thing. And I was just curious on this last line, in here, in regards to new teacher induction program. It says one of the biggest shifts will be related to new teacher mentors. In the past, retired teachers have served in this role. The new shift will provide an opportunity for teacher leaders within the school building to support new teachers and their practice through ongoing cycles. Will this replace teachers as mentors, or we're putting the work on the teacher leader in the building? Is that what I'm getting at? I'm looking at Mr. Hushin.
You want me to start, or do you want to respond?
You can start,
Okay,
and
all
I'll
right.
certainly chime in.
That was part of our administrative meeting today, is just trying to understand where we are with that mentoring program, what worked well in the past, and what are some things that we want to do differently to improve it. And we found that with the way we were running the program, there certainly were some challenges in terms of teachers that were retired and had been retired for a while being well-versed in the utilization of some of the new technology tools and an understanding of the standards. So the feedback from the new teachers, we have the survey information from them, is that they really felt it would be helpful to have someone who is right by their side in the school. Now, of course, like you mentioned, it's give and take. I mean, there's a benefit to that, but the cost is that the teacher now is exhausted because they're trying to plan for their own lessons, and then they have to also work with this other teacher. So we were discussing and trying to get information, principals were sharing things that might work well in that realm. For example, one of our principals said, look, we have collaboration built in every day. So if I had a pair with a new teacher and a mentor teacher, they would have time to meet daily as part of their natural collaboration throughout the day. But we'd also have to build in some intentional time beyond the day. So this year, after much discussion about it, where we landed is that we want to begin with what we're calling, don't you love this word? A hybrid model. We overuse that now. But we were saying we kind of almost need to do a blended approach where we still hold on to some of our mentors that had really great reviews and success with that program, and yet maybe approach at the school level where principals feel it would be a really good fit, and let teachers that are willing to try that out with some sort of incentive. All that has not worked out because we need to define it a little bit more, but that is the thinking, that moving forward, we'd still continue with some of our successful mentors, but bring in some teachers that might want to use that as a track for leadership to get to showcase how they can support and work with one another as well. Do you want to add anything else?
I'll just add that current research across the country shows that having a mentor in the building each day with a new teacher is actually more effective. And, there's a couple different aspects. There's the emotional support piece, right? But then there's the daily instructional practices, the expectations in that school that year. And that's where the person that's in the building really plays a crucial role in helping that new teacher navigate the expectations and the routines of that specific school. The other support piece is where things can be done after school. But I know, we all know, in whatever field we're in, there are times where we need to go to somebody, and we need to go to somebody quick. And having somebody that you can develop a strong rapport with helps in that manner. And when it comes to attrition, having a strong development with somebody inside your school building for a few years shows pretty significant results that we retain staff.
Yeah, I just want to make sure I do understand. I've served as a mentor for many, many years. It just being very intentional. I don't know what the plan for compensation is, and that's a discussion for another time. But I hate for somebody to become a mentor and not just being very intentional about how this looks and not meet with the mentor, because I've had that in my own building. You sign up to be a mentor, I'm getting paid all this money, and I'm not doing my job, and then I'm stuck. So we would really be curious as we develop. It's not, we don't have to go into it right now, but as we go down the line.
Yeah, one of the final things we actually discussed is that, there needs to be, very clear expectations outlined. So.
Any further questions or comments on reopening?
I need to get going. I apologize, but I'm going to have to leave the meeting now. Thank you, everyone.
Thank you.
Thank you, Ms. Sully.
I do agree that I think Niveek's brought up a good point about something celebratory or something that would get everybody excited about a fresh start. And I remember you talking about a bus or something going through. I remember when the middle schools consolidated, and the new principal, who at the time was Jake Voschel, and his staff, they went all through the county to introduce themselves. So, I mean, I don't know what we'll do, but I do think it's important to celebrate. Make everybody feel special.
Dr. Holacker wanted to just respond to one of the questions. She had
I was able to answer your question, Sam, because I was on the state health writing committee for the new framework that's at the state board right now, waiting to be approved. So just to let you know that in addition to making it, since they're making health a full credit, they've added a different part 2 to health, and we've added social action items to the curriculum, to the standards, as well as healthy relationships and consent, gender identity and expression, sexual orientation and identity, and some other things. So it's in there now.
Perfect.
It was just at the state board, waiting to be approved by the state board.
That's one of the many other hats that Dr. Holacker wears. So she also attends our health and PE briefings at the state level. Thank you.
Okay, so I see that the next portion is public participation, community input regarding the reopening plan. Do we have any folks that have signed up to speak for this portion of the meeting?
Or want to speak.
Or want to speak? Okay. Thank you, Ms. Jackmotes, appreciate it.
Thank you for your help.
The next portion of the meeting is the ESSER. Please. Okay, when you do step up, just if you could, again, just announce your name so we
Yeah,
can,
so
she can get
my
it.
name's Julie Dunlap.
Thank you, Julie.
So I just wanted to stress the plan for reopening. You know, I'm a nurse practitioner. I work in the community. American Academy of Pediatrics has put out guidance, you know, that they recommend that all students, vaccinated, unvaccinated, staff in school are masked. So I just could see that this is probably coming, you know, that it's probably coming, that that's what's going to happen. So it seems like we should have a plan in place to be ready for that. And then, yeah, if you're working on Schoology at home, to be able to be online and to do that, because I can't see that that's not going to be something that we're probably going to need at some point during the year, you know, and that's challenging too with your days missing from school. You know, my son had that issue last year of like, okay, we can sit 3 feet apart, but now I've been in 6 feet with someone else and now I'm considered exposed and I'm out for 2 weeks. And, you know, so I think, I don't know, we'll see what happens, but I just want to urge everyone to really be prepared because I think it's coming.
Thank you.
Thank you.
That's what we heard.
Okay, the next portion of the meeting is the ESSER 3 grant. Stewart walking up.
Good evening, President Getz, Dr. Couch, members of the board, and
Good
the
evening.
visiting community. We're going to discuss the ESSER 3 funding PowerPoints.
So just as we're starting again, because schools education uses a lot of acronyms, maybe just to start off with, let's tell everybody what ESSER is.
That's what the first slide is.
Okay.
Oh, you got me. All right, so tonight we're going to talk about the ARP, American Rescue Plan, Elementary and Secondary School Emergency Relief Fund funding, also known as ESSER, ESSER, and I will be presenting this along with Dr. Karen Couch. So what is ESSER 3? Essentially, ESSER 3 is the Elementary and Secondary School Emergency Relief Fund. Under the Federal American Rescue Plan Act of 2021, the department awarded state educational agencies for the purpose of local educational agencies emergency relief funds to safely reopen schools and sustain safe operations of the schools to address the impact of the COVID-19 pandemic. These funds are available from March 13, 2020 through September 30th, 2024, and that is the date that is allocated for this grant. I know this is not included into the PowerPoint, but I do want to make note the total amount that Kent County Public Schools was awarded was $5,236,956.
Do that again.
$5
$5
$236.
million.
5 million, I'm so sorry, $5,236,956. The allowable uses of ESSER, in this particular funding for ESSER 3, there is a mandatory requirement of at least 20% of the funding that has to be allocated to address learning loss through evidence-based interventions, ensuring that the interventions respond to the student's academic, social, and emotional needs. Of that amount, the 20% comes to $1,047,391.20. That's $1,047,391.20.
And we'll add that to the PowerPoint.
Yes. So that is the mandatory portion that we have to allocate to address learning loss due to this pandemic. The remaining funds are available to use, such as with all our CARES funding, the Virus Aid Relief and Economic Security Act, and CRRSA funding the Coronavirus Response and Relief Supplemental Appropriations. And any ESSER funding can be used as well, including hiring new staff and avoiding layoffs. As you know, we've had a funnel of funds come. We have ESSER 1, we have ESSER 2, we have reopening, and we've had the coronavirus relief funding that was based on tutoring technology. So any of the uses that we use for those fundings can be used for ESSER 3 as well. It also can be used to develop strategies and implement public health protocols, including policies in line with CDC guidelines for reopening operating school facilities to effectively maintain safety for students, educators, and staff.
Real quick, so,
So let's stop there.
yeah,
Let some questions happen.
so we've had, this will be our third ESSER. So
Third ESSER under care,
So
yes.
everything, so this, the previous ESSERs don't include, or not included with this 5.
No.
Okay, I just wanted to be,
Nope.
wanted to be clear.
Do
Are
we
there any-
anticipate an ESSER 4 or ESSER 5?
I don't think so.
Okay.
I think this is it.
Okay, just checking.
Well, I guess it depends upon where we are with the pandemic, but
So
I
we
just
shouldn't,
don't-
but we shouldn't, we could be happily surprised if there is, we shouldn't count on it.
No,
Right.
we've been
Okay.
told that there's most likely not going to be any additional funding that's coming our
Okay.
way.
So here's the ESSER 3 funding plans. First, we would like to address the learning loss portion. Under salaries and wages, we have 2 SPED IAs that will assist with intervention instructional support, 1 SPED teacher for infants and toddlers testing play groups, 1 instructional tech support for EduElastic and other technological needs, assisting with Schoology and also formative assessments. Under contractual, we have Imagine Espanol to assist with our Spanish-speaking students, Imagine Math, K through 2nd grade and 3rd grade in geometry. We have Pyramid Training, which is our pre-K, K, SPED, and infants and toddlers. Materials and supplies, McGraw-Hill, The Wonders, 2020. And I believe that's going to be for 6 years.
Let's just take each slide for a little bit and just kind of take it from there. The thing that's really important about the special education IAs is we feel like, since it's for learning loss, we really believe that we're going to have a number of students that are going to be behind. And so we feel like these additional staff members are going to help with providing one-on-one support for those students. And so that's where that's coming from. And then with the special education teacher, Dr. Keene felt that it was very important that we provided some additional support in the infants and toddlers and helping continue the playgroups that we started over the summer. And then continuing that. And then I think the important piece with the tech support is we feel that, like Ms. Dunlap was saying, we got to be able to pivot into potentially using Schoology. We really found out that during the pandemic, we really needed one contact person that was really charged with dealing with Schoology, just flat out, that's their job. And so this person would not only help us with the formative assessments and utilizing EduElastic, but they would help us with, they would be dedicated to helping with Schoology. And then also, we don't feel like it'll be, there might be some additional time that person could use. And so we thought, well, that person could also help with the website. So it could be a webmaster as well, in terms of making sure that things are posted onto the website that are needed in terms of, where we are within the pandemic or where we need to be as far as communicating with parents. So that tech support is just adding one person that's going to be focusing on EduElastic, Schoology, and then the website. So we really don't have someone who's dedicated to do that. We felt that was really important. The contractual piece, because we have to have interventions, we felt very strongly that those interventions would be helpful to continue, and so that's going to cost additional dollars. And then the McGraw-Hill, the Wonders, that's the update that we talked about during the first meeting in terms of updating our curriculum and updating our resources that we have for our reading program, and making sure it fits within the curriculum vetting that is required at the state level.
That's elementary.
That's elementary.
Can I ask a couple questions? So are these positions that we anticipate having in the the 2021-22 school year? Or, because we have a couple years to spend this money, right?
Right.
So.
We're hoping that we can continue, because this money we can utilize through 2024.
Correct. Yeah.
We would continue that for those remainder of the years.
Okay, because I was going to ask you, does this add up to 1.047 mil, or?
No,
Okay.
I was going to kind of address that the last slide when I have things to note.
Okay.
So I can provide more information as to why you don't see numbers and what is the background to that.
Gotcha, okay.
Sam, so the next, I'll let you go ahead and do the next one, and then I can add to.
So the next one is just our remaining uses for the funding, salaries and wages. Of course, to balance the budget, as you know, that we are still working on that to balance the budget for fiscal year 2022. I'm going to address the deficit in that. Adding a teacher specialist at the high school, the need for custodians, 1 full-time, 3 part-time, and that is because we are not clear out of this pandemic. Bringing all the kids back, that's going to require more hands on deck to make sure that our students, our staff, our teachers, everyone is safe still in this pandemic. Bus driver support, because as we go along, there's potential for after-school programs, even tutoring, to address learning loss to help students as well. So transportation will play a big role in that. Substitutes is in here as needed, and I believe Dr. Couch will be
Yeah, I
able
wanted to add
expand
a little
more
bit to that. Again, we're thinking ahead in terms of the pandemic, and potentially some of our teachers that may have to be quarantined, we may have an increased need for substitutes. So we felt that we should be able to, we're probably going to increase and go through our budget fairly quickly with regard to the use of substitutes, so we felt like we needed to allocate more money, and that can be directly tied to COVID, because with more teachers that have to be out, potentially, with COVID, then we are gonna burn through our budget that we normally would use had we not been in this pandemic. So that was an additional allocation we felt was important to add into ESSER. Adding, and this speaks to what you were talking about, Sam, because we recognize that as well, that we need to provide more support for our ESOL students. And so right now, we have a teacher that's being split by high school and middle school. So we felt like if we hired one at the middle school, then the one at the high school could stay and be there full-time to help the students for ESOL. So we recognize that as well. We also added we want to add 5 additional instructional assistants, or at least qualified individuals that can help with contact tracing and helping with the vestibule. Again, we're thinking about all of the time that we had to put in place. The principals had to put into contact tracing whenever we did find a student that had COVID, and then we had to go back and find out, well, who were you sitting next to? Where were you at the bus? Contacting all those parents, making all of those contacts, it's very time consuming. So having another set of hands that can help them with addressing that, I think will make sure that our principals are focused on academics, and this person can help focus on the pandemic, if you will. We talked about this during our prior meeting, but putting a public relations coordinator in place in terms of helping with COVID PR, helping with improving communication and outreach with the community, just making sure that we are the only county that doesn't have someone that's dedicated to PR. So I think we can directly relate it back to, making sure we're communicating better with our families and with our community in terms of COVID and how we address that, but not only that, but just outreach in general to the community. And then equity training for our students and our staff.
What does equity training for students look like?
I'm going to ask our equity person. We've talked about, what it looks like and what we're planning, and so I think it would be better for her to talk about what those plans are.
One of the things we found out this year that we didn't know was that the Challenge Day crew actually has a whole curriculum on equity And we would like to tap into that training for the students because it's already a bona fide curriculum. You know, it'll be delivered in a safe space, so that's what we're looking at for next year.
Would it be district-wide? I mean, would we elementary, middle, and high, or just high
about
school?
I
or-
don't know, it would
think
be
it's more
elementary, I
just
think it'd be
the
secondary.
Yeah.
Okay, that's cool.
Right, so the next one?
We have our contractual and material supplies, professional development training on safety protocols, literacy interventions, PLCs, and data. As I stated, after-school programs, summer school programs for all schools, and after-school programs for all schools, and restorative practice training. There is, if there is a need based on COVID for school furniture, we want to budget for that. Play groups for infants and toddlers, AP testing at the high school, as well as assisting our farm students, and Promethean boards that are needed at the high school.
So one of the things that we talked about is our other ESSER funding takes us through paying for our summer programs for 2 years, but this would take us to year 3 and pay so that we could ensure that whatever we're doing with our summer, like we did the CTE exploration, we did the, at the high school, we also had credit recovery, and at the elementary and the middle school, we had our acceleration academies. So, you know, we want to make sure that we can continue that and continue with the transportation, so that this would give us a source of funding to make sure that we could carry it on for year 3 and offer these programs, because we know it's going to take a while to recover from the pandemic. And if we're really focused on academic achievement, then we need to be able to continue on with these programs and not just drop it and say, well, you know, too bad, we don't have any additional funding. So this would take care of that as well. And since it'll have to be expended by 2024, this would cover us for the 3rd year.
So this might be a place where we can get the furniture.
That's what I was going to ask.
Well, we got to be careful.
Make a
We're gonna
compelling
try.
argument.
We
Yeah.
want to try.
Okay.
But we don't know that we can. I mean, here's some good examples. Like in some cases, we had one of our teacher that purchased some tables, and then she left our employee and she took her tables with her. I mean, they were her own tables. And so during the pandemic, we were able to use desks because we were social distancing. Well, now we're back to, we need the tables, and we don't have the tables. So we can make that connection that we really need it for COVID and that kind of thing. But I don't know that we're going to be able to
Get $100,000
yeah,
for furniture.
Yeah, but we're going to do our best to try to fill in that gap, because we know we do need some school furniture as well. You had a question?
Did I? Oh, yeah,
Okay.
I did. I just see Promethean boards at the high school. Are we just, what about the rest of the schools?
The rest of the schools have Title I money, and they've been able to replace all of their Promethean boards through Title I money. The only school that doesn't have Title I money is Kent County High School. So if we're.
I just want to be clear, because I was in a classroom and one teacher had mentioned to me that they had many other teachers received new materials
Right.
and new boards, and that they hadn't received. So I just want to make sure we're all clear, you know.
Well, they have Title I money that they can use to purchase Promethean boards. And again, if we're thinking about pandemic and being able to teach, you know, in-home or at least face-to-face and virtual, those Promethean boards came in incredibly handy at the middle school and the elementary level in terms of being able to use Schoology in a more effective way. So if we can purchase 44 Promethean boards for the high school and replace all of those with the updated Promethean boards, we feel like that would be monies well spent and could be tied back to COVID in terms of supporting them. And then the AP testing is just for our farm students. We felt like if we could pay for the AP test for our farm students, that would also be a positive.
Have we not
help.
been doing that?
We've not always done that, no.
And then lastly, our other charges, and that is food service, to provide food for all of our students, even in the community, transportation, PPE, personal protective equipment, mental health, other learning loss needs, and fixed charges that are tied to the salaries and wages. And our transfers is the indirect cost portion that we can charge on the grant.
How about putting some money in there? I think it could be related to learning loss too. Do something, I know our elementary schools do one school, one book, which is a good program, but maybe more of it, so, and those kids get the books to keep, right? And,
Yes.
So instead of one book a year, maybe, 5 or so, and have a kind of book club format, but getting, more sort of fun, interesting books that grab kids instead of just all the stuff they're gonna be tested on. I think it would be money well spent, a few $1,000s.
Subscription to Mad Magazine.
Mad Magazine. That's what I read.
Well, and that's what we want. I mean, we're going to go through this, but we want to hear some other ideas as well,
Yeah.
so. Go
So
ahead.
things to note, this is a preliminary budget, and it may be changed at any time of the submission of ESSER 3 funding application. This application was given to us, I believe, at the end of June, right before the holiday break. And they wanted us to get community input and input from board and everybody on how to utilize the funds. It is set to be that we have to submit by next Friday. However, we're in a waiting period of if they will approve us to have an extension, because there's a lot of funding that is out there that we have to actually, provide to MSDE and very detailed on what the funding is going to look like. So the reason why you don't see numbers is because in my stance in having to submit this and go through it, the ESSER fundings have been changing left and right, the uses of it. As time goes on and because of COVID, there are changes. So they're pushing for us to use our prior monies first before we even touch this. So there are going to be funding that we're going to need to use out of ESSER 3, but we still have other ESSER monies that we want to use, we've allocated for. There's also that supplemental funding that we got from the governor that they want us to use that helps with summer school. So that, yes, summer school. So that we then have to backtrack, rewrite. So we can put this here, but I can tell you if another pandemic, we're shut down, we have to go back to virtual, it's all going to change. So getting that input to have a format, we've had to do budget amendments, even in our ESSER 1 funding to add different things. So, just wanted to.
Since the life of the grant, so to speak, takes us through 2024, is the 20%, the 1.047, is that the cumulative or each year do we have to have
That's the
spent?
cumulative.
Okay.
That's the cumulative.
So we could, sort of put some of it aside and use it next
Yeah.
year or the year after.
Right,
Okay.
and one of the things that MSDE is encouraging school systems to do is not to budget to where you've spent all of it, that you
Right.
should put some in hold because you don't know what's going to happen with the pandemic, because this is our only source of money that we're going to have in case we have to go back to pivot back and do some other things that, where we have to provide, food out in the community again, and then we're going to have to pay bus drivers and assistants to go out and work. So, we may have to buy more hotspots and then those kinds of things again. So I think that we have to be very cautious and not spend it to the last dime, because we're going to have some in reserve in case we need it for other things.
So in ESSER 1 and 2 and this moving 3, we've followed MSDE's requirements as to reporting and keeping everything upfront and aligned even with all the changes.
Yes.
And in ESSER 1 and ESSER 2, we actually were looking at, we've had documents at meetings tracking our spending and where we are.
Yes.
And that is the intention to do what we're going to do with ESSER That is the intention for ESSER 3, correct?
Yes,
Okay.
and it's even, with ESSER 3, it's even more detailed. That's why I'm very cautious with what we add, because they want everything to tie back to COVID. We can't just say, okay, we have been doing this, you have the funding, let's go ahead and do. No, it has to come back to COVID. They're actually, at MSDE, they're creating teams that are going to come here and do site visits and monitoring, and they're actually going to comb through what we're actually utilizing our funds and making sure that we're doing it in the way that they have required us to. So it's going to be very intense, and they're starting that planning now, and
That-
it could
that
be as soon
rem-
as September.
That reminds me a little bit when Dr. Couch was talking to the commissioners yesterday, and they wanted to know accountability.
Yeah.
And we haven't gotten that, but it sounds like ESSER's already addressed that. On the second thing to note, talking about the budget can be revised based on pandemic changes or students' needs, da-da-da-da-da. Would that end up coming to the board like as a budget adjustment? Who makes that determination and the change in how the money's spent?
So I work closely with Dr. Couch, because as a superintendent, a lot of the ESSER funding is directed to all the superintendents. So whenever we need to make a budget change, we discuss it and we talk about it, and then we'll put it and bring it back to the board to let them know,
Okay,
hey,
that's
this
what
is
I
what.
meant. It's,
Which is what we've done in 1 and 2.
yeah,
That's what we
okay,
did with 1 and 2.
okay.
Just curious, if I heard you correctly, we have to, it's encouraged that we use ESSER 1 and 2. How much,
All the funding.
yeah, how much do we have left in ESSER 1 and 2?
I don't know off the top of my hand. I know that ESSER 1, we're pretty close to utilizing all those funds. To point of Schoology covers for 21, 22, I think 3 or 4 years. It will take us, I believe, until 2023. So we have Schoology in there. We are also looking to get ductwork done with all of our schools, so that's going to take a huge portion of our remaining ESSER funds. And we still have the indirect costs that we can charge on there, and our non-publics, because there's a portion that we have to give to our non-publics, and that's pretty, we're pretty tight with the ESSER 1 money.
The figure that you have calculated and brought before us, does that include, I'm guessing the non-publics will still?
No, so with ESSER 3 money, that is not a requirement.
Okay, just
So
curious.
we do not
Yeah,
have to.
I think what happened with MSDE is it was just so concerning with regard to how we had to go about, quote, sharing the money with non-publics and making contacts with them, that the MSDE made the decision that they would pull that money out by themselves, and then they would handle it, which is the way I think it should have been done in the first place.
Yeah.
So non-publics now go directly to MSDE, and they get their own allocation, and they go from there, and it doesn't really come out of the locals' allocation anymore.
And
Well, that makes it easier to calculate.
Yeah, it does.
And I do want to add, there is going to be a maintenance of equity requirement with this. MSDE is still going to give further information on that, but the maintenance of equity will involve around making sure that all schools are receiving the same type of assistance and needs as addressing the pandemic and COVID. So they haven't given us the requirements on how to go about that, but that is another requirement that we'll have to look at and probably most likely dive into once it is submitted to us. So,
Any
community
additional
input?
comments on the ESSER 3 grant from the board?
Yeah. And we'll get to you, for sure.
I'm excited that we have this money available. What's stopping us from, say we have a community organization that would like to partner to help, especially in the learning loss? How do we make that happen using maybe some of the ESSER money? Is that possible?
Like, give me an example, I don't know which
Like,
you're.
so if an organization might want to maybe help with tutoring, is there a way, or help with the academic learning loss, is there a way to seed that organization some money to support which is also indirectly supporting us?
We'd have to check on that one.
Yeah, I believe that there is because they do encourage us to, utilize our community, reach out to our community, anybody that wants to assist in that. But I don't know as to specifics around with that, so I can get that answer for you.
I'll give you an example. It's had several different names, but the Learning, whatever it's called now, Center in Rock Hall.
Oh, okay.
Or what if we ended up creating some more of those learning hubs again, or something like that? But I'm thinking specifically of the Rock Hall because it's already established. I don't know if their attention now is just adults. I don't know what it is, but let's pretend it was still students. That would be an example of
Okay.
maybe what you're thinking of, Mr. Johnson.
Yeah,
Yeah, great. Okay, the next portion of the present or the evening is public participation pertaining specifically to the ESSER 3 grant. Do we
Come on
have?
up. Yeah, just come on up.
Yeah, just a reminder, speakers limiting their comments to 3 minutes. Comments about the actions or statements of individual staff members are not appropriate for public comments. Should be referred to the superintendent of schools or processed through available channels. If submitting written testimony, speakers are requested to provide a copy to the president. Please remember, it's an opportunity for the community to address their comments to the board, not an opportunity for dialogue. If you have questions that need an answer, please contact the superintendent or write a letter to the Board of Ed, and a response will be sent back to you. If you have the ability to sign cards, please do so that Ms. Gale can put it in the record, and we'll go from there. Thank you.
My name is Tammy Buckle. I'm a parent of 2 Kent County Public School students. And first of all, I want to thank you for allowing us to be a part of this and be able to have community input. We certainly appreciate it. One question I had was whether or not we could, I'm not a numbers person, of whether or not we could have, monthly, if this could be presented. Also in terms of trying to, get our website looking a little bit better, could we have, I tried to find what money we've used for ESSER 1 and ESSER 2, and I was digging around, but I couldn't find what we've done. So is there any way that we could even have, it sounds like we don't have the ability to put numbers to the data yet, but if we could have, I was looking at what some other counties have done, and they'll have ESSER 1, ESSER 2, and ESSER 3, and what's been spent, what we have, you kind of get confused by 1, 2, and 3. So if we could kind of just have like a running tab of that. I know some of the parents and we were talking about, what about ventilation and HVAC issues, and it sounds like that's already been addressed, but just to be able to make it a little more user-friendly as well. And is one thing I didn't know with my practice is I applied for the PPP loans to kind of keep my staff going. And I didn't know if there's, I don't know where CARES enters into this, if CARES is the same as ESSER 1. But my employees were kind of paid through the PPP. Were the employees at Kent County Public Schools, was there a similar type of program that paid the employees through the CARES Act? How was that, was that part of, so it was just all part of our budget and everything too. So just to sort of have an understanding, I don't know the difference between 1, 2, and 3 and how that's spent. Okay. I love the idea about having someone for PR. The only thing I would ask is if we can make sure that they actually have training in PR.
Exactly.
And not just have somebody moved over to position and call them a PR person. The other thing I'd like to see is we talk a lot about the learning loss for special education, and I'm not sure where the gifted and talented falls under that, but I'm sure there was equal learning loss for the gifted and talented students as well, so we could find out what losses there were for those kids as well. Another thing I thought about was to have some sort of focus. I don't know how you tie this into COVID necessarily, but for leadership training for staff and admin. I've always noticed with the board meetings, thank you, Dr. Sperry and Ms. Hemstetter for attending. We just don't have the attendance from, why did our principals and assistant principals leave? Is it, I don't know if, and even with parents, are there more parents that just because it makes it easier to sit home watching on Facebook Live, that they're not coming, but you definitely get a different experience. So is there something that we can focus on mental health-wise, not just for the students, but for staff and admin? And, you know, I feel like we've kind of lost that connection, because it's so easy just to sit home and watch it live as well. So I'm hoping that we can focus on staff and admin for mental illness with it as well. And I like the idea about the paying for the AP classes, but I didn't know I had no idea how expensive these classes are until Sam started doing dual enrollment. And we're spending like $900 and some for these classes. I thought when you took dual enrollment classes, I thought, that's great, you know, the high school pays for it. Well, they don't. But not everybody has the luxury to be able to pay for those classes. So if maybe we could kind of figure out a way that you could help students that can't afford their dual enrollment classes, and maybe it's already in place, if we could somehow figure out how to help them as well. And I think that's it. And thank you for letting us be involved.
Thank you. Okay,
Wait, I think there's
do we have
others.
more?
Yeah.
Please. I have a hard time seeing the half hands.
Yeah.
Good evening, Board President Getz, as well as board members, as well as Dr. Couch and everybody else that is in attendance. Some of you may remember me, but I am Amy Crowding, and I am the Executive Director of Horizons now. And so I just wanted to bring you up to date. We were having an amazing summer. In fact, next week is actually the last week of the program. I know that we have Mr. Johnson, and he's one of our instructors. Also, I want to thank Dr. Couch for reading One School, One Book, as well as Dr. Costa, as well as many of our principals as well. It really takes a village, and so we are just very appreciative of all your support. I think I am going to be submitting a package just to sort of give you an overview of the Horizons program. But as you're looking at ESSA, remember, we would love to partner with you. Right now, I think we are paying about $22,000 in transportation. So if there's a way that perhaps we could work together on that, that would be amazing. Our kids really can't participate in our program if we do not provide transportation. So just something to think about as you move forward. But thank you for everything that you're doing. We really are appreciative. So thanks.
Horizons was the organization I was thinking of, but I didn't want to put Amy on the spot just in case she wasn't going to say anything. So I pulled the Rock Hall Learning Center out of my hat.
Okay, got it. Good pull.
Any additional comments?
Yeah, that's fine.
Mm-hmm.
Add the middle school and the high school to the learning loss. I think Tammy might have touched on it, but that was just something that I didn't see. It was all elementary school, and I think the middle school and high school should be added to that. Thanks.
Thank you. Okay, last call. All right, the next item on the agenda is the notification of our next meeting. The next meeting of the Board of Education of Kent County will be held on August 9th, 2021, beginning at 5:30 p.m. with the open session. Open session will be immediately followed by the board members going into closed session. The open session will resume at 6:30 p.m. This meeting will be located at the administrative building in the boardroom in this room at 5608 Boundary Avenue, Rock Hall, Maryland 21661. The last item on the agenda this evening is to adjourn. The administration is recommending approval to adjourn the meeting. Do we have a motion to do so?
So moved.
We have a motion by Mr. Johnson. Do we have a second?
Second.
We have a second by Ms. McGee. Any further comments? Hearing none, we'll call for the vote. All those in favor?
Aye.
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 Opposed? Hearing none, the motion passes. This meeting